Now we're going to go over to Saray. She's standing by with today's Good Health for Utah segment.
Yes, after having baby, getting back into shape can be very tough, but there is help out there. And for more on mommy makeovers, I'm joined by Dr. Kimball Crofts, a plastic surgeon with Mountain Point Medical Center. Thank you so much for being here.
Good to be here.
It's so ironic that you are here, or coincidental, because I was just talking about this with my girlfriends today about tummy tucks.
Yeah.
So let's talk about what mommies after childbirth, what are they looking for to look better and to feel better?
Well, you know, mommy makeover is a term that captures a number of different procedures that are done to address a lot of the unwanted changes that come with pregnancy, weight gain, weight loss. Usually what women see is the most common deals with the tummy, where they'll get a spreading of the muscles. We call it a diastasis. And then they get loose skin, extra skin, sometimes stretch marks. They can gather fat in certain areas, and sometimes things can change with the breasts. So typically a mommy makeover deals with a tummy tuck, breast dog and lift, and lipo, or a combination of those. And some are surgical, some are not surgical.
And so those are the things that people are most common in terms of
Correct.
Makeovers. And we've got the tummy tuck, the vellus shape. What is that exactly?
Vellus shape's a radio frequency that just tightens skin, but it's something that requires repetitive treatments. And it's, you know, at some point you're going to need a surgical procedure to tighten skin if it's loose enough.
And we were just talking about this. Personally, I can work out as much as I can, but this tummy area still exists.
Won't change.
It won't change. That is the reality.
It's frustrating.
It's so frustrating.
Yeah. So, and that's one of those things, that spreading of the abdominal muscles, it takes surgery. You have to go in, you have to pull the muscles back together and suture them down the midline. And that's the plication stage. And that's what takes so long to heal after a tummy tuck. But really, that's the only way to get a flat tummy.
And so what is the mommy makeover you're talking about?
Well, typically that would be, that's part of the consultation, where people come in and we determine what it is they need done, what their expectations are, where they want to go with everything. But a typical tummy tuck, a typical mommy makeover is a tummy tuck, breast surgery, and lipo, a combination of those things.
And we're also talking about how long is this procedure and what is the downtime?
So just a straightforward tummy tuck can be roughly around 2 hours of surgery time. It takes about 2 weeks to get to where you're standing straight, and then it takes about 6 weeks for the muscle to heal completely to where you can start doing everything again.
We just saw some before and after pictures, and it is phenomenal, revolutionary. But not only in physical terms, but what mentally does a mom go through when they can see their body change like that?
Well, it's huge. Psychologically, it's a huge thing, because you go along looking like this, then you have a child or 2 or 3 or whatever, and then it just changes your body. Some of those things you can't avoid. It just happens. And so you have these unwanted changes, and it makes a huge difference, because you walk around with these changes, and you want to get rid of those. You want to get a flat tummy again, and it makes people feel so much better. A lot of them go out and get new wardrobes afterwards.
And that's always exciting. And the faces and the change that you see in your patients must be astounding.
Yeah, it's people are pretty appreciative. They love it. It's a big operation, but it works well.
Okay, for more information, where can they find you?
I'm at Mountain Point Medical Center. My office is in Linden at Aesthetica Plastic Surgery.
And for more information, we'll put that on our website at goodforutah.com. Glenn?